High blood pressure, it's called the silent killer for a reason. You might feel perfectly fine, until suddenly, you're not. In this video, we'll uncover the 6 warning signs your body may be sending, and the science behind why you should never ignore them. Do you often wake up with a throbbing pain at the back of your head? It could be more than just stress or lack of sleep. According to the Mayo Clinic, morning headaches are linked to higher nighttime blood pressure. When your blood pressure spikes during sleep, it increases pressure inside the skull, triggering pain especially at the back of your head. If this happens frequently, it's time to monitor your blood pressure, not just assume it's stress. Ever stood up and suddenly felt like the room spun? The American Heart Association notes that hypertension affects blood flow to the brain. When vessels stiffen, oxygen supply briefly drops, leading to dizziness, even fainting. Ignoring it may seem harmless, but in the long run, it's a sign your vascular system is under serious strain. When your vision suddenly blurs or doubles, don't just blame your glasses. High blood pressure can damage tiny blood vessels in your eyes, a condition known as hypertensive retinopathy. According to Cleveland Clinic, this damage may cause vision changes and, in severe cases, even blindness. Getting a simple eye exam can sometimes reveal hypertension before you even measure your blood pressure. If climbing a few stairs leaves you gasping, your heart might be working harder than you think. When blood pressure is high, your heart must pump against extra resistance. Over time, the heart thickens, a condition called left ventricular hypertrophy. The American College of Cardiology warns it can lead to heart failure if ignored. This symptom is your heart's cry for help. Listen before it's too late. Occasional nosebleeds can happen to anyone, dry weather allergies, but frequent ones, that's a red flag. The Journal of Hypertension Research found that sudden spikes in blood pressure can rupture delicate nasal blood vessels, especially when systolic pressure exceeds 160 mmHg. If you're reaching for tissues too often, check your numbers instead. Feeling exhausted after small tasks, or a strange tightness in your chest. The National Institutes of Health explains that hypertension forces your heart to pump harder. Over time, the muscle tires, reducing oxygen supply to the body, making you feel drained even after rest. Some even describe it as a silent weight pressing on their chest, a subtle but serious sign. Let's recap what's happening inside your body. High blood pressure, or hypertension, means your blood is pushing too hard against your artery walls. Over time, this damages the vessels, your heart, kidneys, and even your brain. According to the World Health Organization, nearly 1.3 billion people live with hypertension, and nearly half don't even know it. That's why regular blood pressure checks are vital even if you feel fine. The good news, you can control it. Eat less salt and processed food, move your body 30 minutes a day, get enough sleep, and manage stress. The CDC confirms these simple habits can drop systolic pressure by up to 10 mmHg. And of course, follow your doctor's advice and take your prescribed medication consistently. Remember, high blood pressure doesn't always shout. Sometimes, it whispers. Pay attention to the whispers, because your life depends on it. If you found this helpful, don't forget to subscribe for more science-based health tips every day, because your health deserves your attention.